The ACL is a very important ligament on the center of the knee, which is critical for providing stability to the joint. Now, unfortunately, it's one of those structures that very commonly can get torn in the knee, and there's approximately 300,000 to 400,000 ACL tears every year. Now, for those people who are going to have surgery, the question is can we fix it or do we need to replace it? Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. In this image, which is a cartoon image of the knee, you have the femur bone, which is the end of the thigh bone, and the leg bone, which is called the tibia. Now, in this image, I've drawn in the different ligaments, and there are 4 important ligaments, but the main one we're talking about in the center of the knee is called the ACL. Very commonly, when the ACL tears, it will tear within its mid-substance, as we see here in this image. Now, here is an arthroscopic image of a tear that's an intrasubstance tear, and you can see it's kind of balled up. So this was one that needed to be replaced, what we call reconstruction. Now, in this scenario, when someone is having surgery, we can't typically fix this type of a tear, and then we would end up needing to do what's called a reconstruction, meaning we have to replace the ACL. We need to put in new material that we can put in there, and that's donated material, either the individual themselves, we could take material from them, or from a donor. And here's an image where we show what that might look like when we put in the new ACL. Now, in some cases, the ACL tears right off of the femur bone, and this we can call an avulsion tear. So in this scenario, we sometimes have the option where we can fix it instead of replacing it. Now, so in this image, I've drawn a picture where we have some sutures that we put in the ACL, and then those are connected through the bone to a little button to support it. And that's the way that we can fix this. Now, very often as part of the technique, we'll also put what's called internal brace sutures. These are sutures that will run along together with the ACL. And these are important because it can help reduce the stress on the ACL ligament while it is healing. Now, here's an image where you can see that the ACL is torn off of its attachment to the bone on the femur bone. And here we have a probe in here, and you can see I'm pushing the ligament away from its normal attachment. And then in this image, this is after we've now fixed it, and you can also see the internal brace sutures. There are studies that look at this technique, and they have found that it can be a good option in those ACL tears that have avulsed off of the bone, and also in patients who are slightly older. It doesn't seem to work so well in adolescents. In a meta-analysis of 13 studies with over 400 patients, and these are people who had undergone the ACL repair surgery with that suture, internal brace suture augmentation that I showed in the previous pictures. And what they found was that overall for everybody, when they looked at everyone together, there was about a 92% success rate, which meant that about 8% of these retore. But when they broke it down into age, they found that for younger people with an average age of 15 years old, so adolescents, their failure rate was 17%. But for those people who are older with an average age of 35, their failure rate was only 6%, which meant that 94% of people this ACL repair worked great. So for a select group of people, we can fix the ACL instead of having to replace it. So when you see your surgeon, please speak to them about what type of tear and what your options are. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.